And then the next question is, well, how do we go about modifying it? Well, we can add isometrics, we can add pauses. We know that adding isometrics can help with pain modulation significantly. We can also reduce the range of motion. So if, let's say, they're having pain at the bottom of an overhead press, we can reduce the range of motion a little bit. Maybe that offloads the mechanics and it feels better. Continue on, right? We can change the position. So for example, overhead press, we can go into an Arnold press. That's going to change the position of the stress and of the load. It's not inherently better or worse, but it's a different position than what's painful. Oh, it works? Fantastic. Continue on. We can pick a new exercise, right? The goal should never be to do nothing. The goal should always be to modify around the pain to do as much as we can. And there are days where patients will come in maybe, you try bench press, it's just not happening that day. You try all the modifications, it's not happening. Okay, pick a different exercise. You don't want to get frustrated and turn around and leave because that is just going to cause a cascade effect. You're getting weaker, more deconditioning, less loading, then more and more things become painful as opposed to going the opposite way. Okay? So this is kind of the framework that I use. I will tell patients this because the goal is to create some independence where they can manage a lot of these things on their own. These are symptoms we don't want to work through. These are ways we can work around these types of symptoms, but we always need to find some type of alternative or other activity to, stay active.